In March of 2020, schools across the United States began to close in response to the spread of the COVID-19 virus.
Now to breaking news out of Tallahassee. Just about an hour ago, Governor Ron DeSantis announcing students will not physically return to school for the remainder of the school year.
And I think the last thing you want to do is force everyone in school and have half the kids not show up because their parents didn't want, have teachers not want to do it. So I think it was easier decision for me to make.
As a result, lots of parents took on the role of homeschool teacher, making sure their kids were on the right Zoom calls at the right time. But what effect did schools closing have on children that relied on school for more than just general education? What about children with special learning needs?
We won't know for, I think, years what the impact of COVID really has been on these learners with autism who've lost out on, critical months of therapy.
I'm Autumn-Jade Stoner. I'm a sophomore at Brown University, and I wanted to find out more about how schools closing have affected the routines of parents of children with autism spectrum disorder, or ASD.
My name is Juliana Carranza. I'm from Peru, but I've been living in South Florida for the last 20 years. I have only one child. His name is Gabriel. He's 17, and he was 4 to 5, about to start kindergarten when he got the autism diagnosis. Before COVID, I got, my life pretty organized. Dealing with autism give you a lot of structure if you want to follow your program, your routine, your whatever schedule. But with COVID, everything stopped and went virtual. COVID has literally messed it up. Everything changed.
These kids, they thrive on routine, they thrive on consistency, and COVID just upended all of that.
To find out more about how schools closing and other pandemic measures may have impacted the routines of children with ASD, I spoke to Dr. Michael Alessandri, clinical professor of psychology at the University of Miami and the executive director of the UM Center for Autism and Related Disabilities, otherwise known as CARD.
During the pandemic, things just got significantly heightened in terms of more isolation, less access to care. The quality of care really was lower than it had ever been because you can't do high quality care remotely for children with autism. They need face-to-face, physical, in-person, real people delivering therapy, right? Under highly controlled conditions with a lot of physical prompting. You sometimes have to really manipulate a child into executing the response that you want them to exhibit using what we call prompting techniques.
One of the main difficulties presented by the COVID-19 pandemic is that many of the therapies that children with autism use on a regular basis aren't able to be done well in person. This places a lot more responsibility on the parents' end and can place a significant burden on them, especially if they're working parents or they simply don't have the time or energy to also double as a paraprofessional.
They've been under stress emotionally, they've been under financial stress, kids have been home who normally would be at school, so there's the added burden of caretaking is already there, but caretaking 24/7 when the kids don't have school or therapy to go to makes it even more challenging. And then what role does that play in a child's response to treatment? Like if the parent is depleted and the parent's being expected to help deliver the treatment, what's the quality of the treatment and how is that impacted? What it requires is that someone be with the child to prompt them through certain responses. So we have, for example, our students are with their supervisors delivering applied behavior analysis via telehealth, but there is some support on the other end of on the other computer. So usually a parent or a nanny or a teacher or another sibling or a therapist, someone really, depending on the functioning level of the child, most of the time someone else needs to be in the room with the child to deliver the exercises live. It's not as effective, certainly, but some therapy is better than no therapy in the context of COVID.
One of the main concerns that Dr. Alessandri spoke about was the access and quality of therapies. Many children with autism access their therapies through the school district, at least partially. According to the National Center for Education Statistics, Approximately 14% of all public school students in the United States received special education services in 2019 under the Individuals with Disabilities Education Act, or IDEA. Under IDEA, all public schools are legally required to provide appropriate educational services to children with a clinical diagnosis of one of the 13 outlined disabilities. These include ASD, speech and hearing impairment, and specific learning disabilities such as dyslexia.
Those students develop an IEP, an individualized education program.
An IEP is a document that assigns a team of specialists to work with the family to develop a plan of accommodations in order to help the student meet their needs. But during the COVID-19 pandemic, many parents report their school's lack of accountability in fulfilling those IEP entitlements, since everything's remote now. This is especially harmful to children with ASD.
It's a lot of work for everyone. It takes a village. It really does. He has a whole group of adults that help push him along and keep him going in the right path.
That's Wendy West.
My name is Wendy West. I live in Key Largo, Florida. I'm a special education attorney. I work for the state's protection and advocacy organizations. My son is 14 and he was diagnosed when he was 2 years old. Just prior to the pandemic, he was still doing his ABA therapy, which is applied behavior analysis. He was doing his speech therapy in the school setting and privately. And he was also attending pragmatic social skills groups privately. Since the pandemic hit, he has continued to do all of those things virtually. So his pro that worked with him in the school setting zooms in with him every class. So about 20 minutes into class, she will call him into her classroom, and so he can work with a small group of other students and help them get any kind of extra help they need.
Like Wendy said, it takes a village. This is part of the difficulty of doing remote therapies for children with autism, because lots of children with autism have complex therapy teams made up of specialists to meet every part of their needs. When the pandemic hit, there was a lot of turnover in these therapy teams. Some disbanded, some moved online, and some parents just opted out completely because they didn't think that it would be effective. Either way, there were lots of disruptions to kids' consistent schedules. On the other hand, it is possible to do successful therapies remotely. Some parents even find it more convenient.
His speech, indirectly got a positive impact. He was having a speech 2 to 3 times, and I was taking him to the center. But now that it's virtual, they're doing it 4 times a week from the comfort of your home.
Dr. Alessandri talked to me about how telehealth is actually a really useful tool for individuals with autism, especially those who are nonverbal.
There does appear to be an affinity for many children with autism toward technology. Not all, certainly. You can't say anything about all children with autism, but they're drawn, it seems, to some of the technologies, and they do like the apps. I think a lot of the apps are very cause and effect and have a lot of kind of interesting visual stimulation and auditory stimulation, and I think there's probably something there that keeps them engaged. I also think, apps are not terribly social, right? So it's a little bit of an easier experience for a child with autism because they're not forced to interact with other human beings, which is more difficult for them.
Wendy also expressed a similar concern, in which telehealth might be better for the individual, but it's not so great for social skills and practicing those.
There are some students who have really thrived in the e-learning environment because a lot of the things that gave them a problem were stimulus-based, meaning they have extreme anxiety. And when they're in a classroom with 32 students all talking at the same time, throwing stuff around, it makes their anxiety off the charts. And then they react behaviorally, and then they get disciplined for it. Well, when you remove all of that stimuli from their environment, they're very successful academically. How successful are they at working on self-regulation and learning how to not let your anxiety take you over the roof. I don't know. I don't think that they're doing a lot of work on that right now.
Now, the aspect of social isolation during COVID means something entirely different for children with autism. Social interaction is something that needs to be learned, and a lot of the therapies providing that social interaction within groups has been taken away.
You can go in and teach all those other skills that the rest of us learn just by sitting in our environments. You know, we pull that stuff in almost like through osmosis. Individuals on the spectrum can learn all of those skills, but they don't learn them through osmosis. They need direct, explicit instruction.
So a lot of the therapy in autism is one-on-one with a therapist and a child, and that's really helpful in the early stages of treatment when you're actually trying to build kind of foundational skills for the child. But as the child moves on developmentally, you want them to be getting therapy in a more natural context. So a small group, if they're teaching language or social skills, a classroom environment, maybe a sporting activity. Like every goal that you work on with a child, whether it's a language goal, a cognitive goal, even a motor goal or a social goal, should be kind of approached with social implications, right? We should understand what the meaning of this skill is in a broader social context. So we're not teaching a child to speak just so that the child has the skill to speak. We want them to speak so that they can communicate with a social partner. We're not teaching them how to play with a toy just to play in an isolated fashion with a toy. We're teaching them to play with a toy so that they can have a shared experience with a social partner. Because to do therapy just in an isolated fashion for your entire life, you never get to practice the skills and generalize them in a more natural setting with your playmates and your peers and your friends. Therapy can be very limiting, the kinds of therapy for children with autism, if it doesn't branch out from that initial therapeutic context.
Children with autism are at high risk of regression if they're not being given their regular therapies.
One of the things that we know about autism is if you suspend therapy for a period of time, like the summer vacation, for example, you do see regression of skills. Kids with autism don't maintain their skills very well, so you have to keep the therapy going in some capacity.
The isolation of the pandemic adds on to this, and it's a real concern for parents.
Prior to COVID, he was at that final frontier of everything else. He's in general education, he's on grade level, he's a straight A student, in old general education classes, but socially he is still very, very delayed. And the pandemic has a negative impact on that.
He's into electronics, and I guess at the beginning it was pretty cool to do everything virtual, but then it was a point like, okay, again, he didn't want to connect. He got bored, okay? And then the sense of not seeing people, made him to isolate even more. And we are social people.
The lack of social interaction has also been taking a toll on parents.
Even for him to go into the theater, the theater has two kids that are pretty much the same age as him, so they had grown together. So for him, going to the theater was going to his friend's house, you know what I'm saying? And at the same time, it was an escape for me and my husband, like a night out, But everything stopped. No more night out. So stress has always been part of our life. And autism, we needed that going out. Some kind of relief, bend, escape, whatever you want to call it.
Families with children with autism face unique challenges relating to at-home schooling and at-home therapies, as we've just heard. But what about basic pandemic adjustment? None of this is normal. For most of us, mask wearing, washing our hands religiously all the time, and trying really hard to stay 6 feet away from everyone around us is all new, and it's all challenging. But individuals with autism are highly sensitive to external stimuli and can very easily get overwhelmed.
Those children that are deeply affected by their disability are also the same ones who struggle to wear masks. So, there's that fine line between public health and human need for education. Where is it? I don't know.
So, with schools reopening and kids going back into the public spaces, there's a lot to think about.
On top of things and work, he has his sanitizer, he has his noise canceling headphones, he has the earplugs because noise is a big issue in school. He has an extra mask, he has his own mask, he has the face shield. Believe me, it's a lot of things to deal with. And I even was looking for some legal advice in case that he wasn't able to keep it on. But thanks God it worked out perfectly. It wasn't necessary. Because you have to comply and you have to keep it on that time. But I didn't know it would be any sensory, issue. The fabric will be too much. It will be you know what I'm saying? All those little things that not any other mom might be dealing with, but we autism parents have to. At the beginning, when we went to get the school computer, he didn't want to wear the mask. And my husband got those fancy ones, like a kind of, not the N95, the other fancier, like a kind of lab mask. And we went to school, and he didn't want to get out of the car. He said, "You're making a big deal, Mom." So I had to drive around the parking lot and showing the line, all the families standing in line with their mask for him to believe me because he thought that I was making it up. He said, "Do you see? Look. What do you think they're doing that for? Just to show off? Just because they want to play with masks on their faces? No, this is real." I had to go on Google and show him this is what's happening. Read the news.
Now, this entire conversation about COVID-19, who it affects and how it affects them, special education law, disability justice, all call into question equity. Even prior to COVID-19, the largest barriers to accessing proper care include cost, availability of resources, and frankly, one's proximity to a support network.
I mean, the biggest challenge is getting access to quality care. I think that's always been and always will be probably the biggest challenge, particularly because, while a lot of people know about autism now, there aren't as many highly qualified specialists who really can deliver the best evidence-based practices that we have. So, families they have to cobble together a treatment team.
Experts might recommend 40 hours of therapy a week, and without good private insurance, developmental outcomes for individuals with autism are vastly inequitable.
If you don't have insurance and you don't have wealth and you have to pay out of pocket, you're just not going to get therapy.
Like many other intersectional health inequities, racial bias also plays a role in not only who gets access to quality care, but also how individuals are considered for diagnosis to begin with.
There are tremendous gaps in access for minority families, Hispanic families, Black families, people who don't speak English as a primary language. I mean, there's still, significant delays in getting care, and there's also a lot of misdiagnosis among minority kids with autism, particularly Black kids. Black kids with autism are often diagnosed with something other than autism. Maybe an emotional or behavioral disorder, maybe an intellectual disability. They're actually about 3 times more likely to be diagnosed with one of those other disorders than they should be based on prevalence data and risk. We also see that, kids with autism are diagnosed much later when they are Black or Hispanic. It's a kind of a snowball effect. You get diagnosed later. When you get diagnosed, you don't necessarily have access to the highest quality care, and that continues throughout life. So the outcomes are not as positive.
With the onset of the COVID-19 pandemic, diagnosis and cost remain the largest barriers to care for individuals with autism.
In order to be eligible for therapies and specialized instruction and all that, you have to have a diagnosis. So just getting diagnoses during this pandemic has been almost impossible because a lot of the diagnostic clinics were closed. They weren't doing face-to-face diagnoses. And so a process that's already very slow to begin with, and there's about a 4 to 6 month wait to get this diagnosed, to get the diagnostics completed, and to have the evaluation report and have the actual diagnosis in your hand that you run to the doctor and go, look, he's on the spectrum. I need a prescription for ABA, speech, and OT. You have to first get that diagnosis. So that came to a screeching halt when the pandemic hit, and it's still not back up and running like it should be.
In the midst of a pandemic that has caused disproportionately more deaths and more severe economic setbacks in low-income communities of color, these statistics aren't coincidences. On top of these documented health inequities, parents of children with autism also need to be on top of their advocacy. Not all IEPs are created equal. And a parent's social standing and ability to understand an IEP is going to determine how well it's going to be followed.
You need to be on Google knowing exactly what your kid is supposed to be getting in the school district. So when you're the parent of a child with a disability, you have to be an expert at just about everything disability related. And if you don't have that expertise, there are two worlds. The one world is the kids and individuals whose parents know what's going on. And then the other world is the kids and individuals with disabilities whose parents had no idea.
And during this pandemic, IEPs are going to be more important than ever to ensure that children are actually getting what they need, and that school districts are providing them all the services they should be afforded.
Because you can have a perfect IEP, right? You can have that IEP that's dipped in gold. And if nobody's implementing it, it's not worth the paper it's written on. And we see that across the level. You have the haves and the have-nots. It's very pronounced in the disability community, the haves and the have-nots. And then when you throw on top of that we have a lot of poverty in this population. So if you're poor and disabled, there is no level playing field for you. There just isn't. And that's not okay.
CARD is an example of an organization that helps match parents with resources like this, including advocacy training to help them navigate the IEP process and demand the accommodations that their child needs.
The goal was really to do 4 things. One is to support clients and families directly in their communities, provide training for professionals so that we could have the best practice and best knowledge in our local communities, provide assistance to schools and to other kinds of programs that serve people with autism and related disabilities, and then also do a lot of public education and awareness.
Not even the resources, the tools, the training is they teach you how to advocate. They have always been there. They have never said no to our families. And I don't know where my son, my family, myself, we have been at this time if it weren't for them, though. It's like, as I said, all what I have learned is because of them.
Like, every person with autism can work. Every person with autism brings value to the world. Every person with autism has something meaningful to contribute. But we have to create a world that allows them to realize that potential. I just hope we continue to grow, really. I mean, we just want to serve everyone that needs us, not just the ones that find us.
So, how has this pandemic affected children with autism and their parents? For the past 8 months, COVID-19 has and will continue to bring about unprecedented changes for children with autism and their families, and its long-term effects will be difficult to predict. In the broader context of educational equity, it's likely that increased social support networks among parents, low-cost or free provision of therapy services and advocacy training, and school-based accommodations would benefit the community during emergency pandemic measures. There's a lot to learn from the way this pandemic has exacerbated rifts in access that already existed. But for now, Dr. Alessandri is hopeful that there's light at the end of the tunnel.
Pre-pandemic, the challenges were already enormous. I think parents would tell you that, even though most of them, I think, cope remarkably well given the challenges that they're facing, because they our families they have such fortitude. I mean, one of the things that's always struck me, and we've done some research on this, is that families cope as well as they do, despite the challenges, right? Because, there aren't any, the other options aren't great. So you figure it out as a family. Our families really learned to figure it out. But pre-pandemic, they had many enormous struggles already.
For a lot of us, the pandemic has made it feel like our normal coping mechanisms are out of reach. But for families of children with ASD, adaptation, change, and resilience are nothing new. Both Juliana and Wendy expressed to me feelings of optimism, hope, and trying to look at the positive sides of things, both for their own good and their children's.
This whole pandemic, I've just spent my time focusing on the good stuff that's happening and trying not to become consumed and obsessed with all the bad stuff, because there's so much of it and it's so out of my control that I'm just focusing on the things that I can control, and I'm giving people as much grace as possible because everybody's going through this together, but we're all having very different experiences.
Our kids, they're extremely sensitive, and either you want it or not, they know when you are not okay, you know what I mean? So somehow you have to find strength whatever you can and just keep pushing forward. You have to see the positive though. I mean, it's not like just be mad at the world. No. It's nobody's fault. You have to learn, you have to digest it, take it in, get a shot of tequila, and then move forward, seriously.
Special thanks to Dr. Alessandri and Professor Catherine Mason for their help on this episode.